Ever wonder what chemotherapy is and how it works in our body? Chemotherapy, a term that might sound familiar. It's a type of cancer treatment that has been around for quite some time. But what is it exactly? Well, at its core, chemotherapy utilizes strong medications designed to destroy rapidly dividing cells, a characteristic feature of cancer cells. It's a widely used treatment strategy in the medical field, often applied in conjunction with other treatments like surgery or radiation. The goal? To stop cancer from spreading, slow its growth, or to completely eliminate cancer cells. Chemotherapy, however, is not a one-size-fits-all approach. Its use and effectiveness can vary significantly depending on the type of cancer, its stage, and other individual patient factors. It's a complex yet fascinating subject, a testament to how far we've come in our understanding of cancer and how to fight it. So, let's delve deeper into this fascinating world of chemotherapy. What exactly happens when it enters our body? Chemotherapy, in essence, is a war strategy against cancer cells, but how? Imagine the body as a bustling city and cancer cells as invaders trying to take over. Chemotherapy is like our city's defense force, designed to stop these invaders. The drugs used in chemotherapy specifically target these cancer cells and interfere with their ability to divide and reproduce. Now, you may wonder, why is this important? Well, cancer cells are notorious for their rapid and uncontrolled division. By disrupting this process, chemotherapy drugs effectively halt the spread of cancer, giving our body's defense mechanisms a fighting chance. There's a vast array of chemotherapy drugs, each with a unique mode of action. Some drugs, often called cell cycle-specific drugs, work at specific points in the life cycle of a cancer cell. For instance, some drugs target the cells when they are actively dividing, while others attack during the resting phase. Take antimetabolites, for example. These cunning compounds trick the cancer cells into incorporating them during DNA replication, which ultimately leads to faulty, non-functioning DNA. This prevents the cell from dividing and eventually leads to its death. Then there are alkylating agents, another type of chemotherapy drug. These agents work by attaching an alkyl group to the cancer cell's DNA. This damages the DNA and prevents the cancer cell from reproducing. There's also a category of drugs called topoisomerase inhibitors. These drugs interrupt the action of topoisomerases, which are enzymes that cancer cells need to divide. By inhibiting these enzymes, the drugs can stop the cells from dividing and growing. In other words, each chemotherapy drug has a different tactic, but their ultimate goal is the same: to stop the cancer cells from dividing and spreading. It's also important to note that chemotherapy isn't a solo act. It's often used in conjunction with other treatments like surgery or radiation. The combined efforts give us a better chance of winning the war against cancer. In essence, chemotherapy is a systematic approach to disrupt the life cycle of cancer cells. Though a powerful weapon, chemotherapy does have its side effects. As potent as it is against cancer, chemotherapy doesn't discriminate between cancerous cells and healthy cells. This lack of selectivity can lead to a range of side effects that vary in intensity from person to person. One of the most common side effects is fatigue. This is not just ordinary tiredness, but a profound exhaustion that doesn't improve with rest. It occurs because chemotherapy drugs can affect the red blood cells, which are responsible for carrying oxygen around the body. When their numbers dwindle, the body has to work harder to perform its normal functions, leading to fatigue. The second side effect we often associate with chemotherapy is hair loss or alopecia. This happens because hair follicles are among the fastest growing cells in the body, and chemotherapy targets rapidly dividing cells. When hair follicles are affected by the drugs, they can't produce hair efficiently, leading to hair fall. Thirdly, nausea and vomiting are also common. The reason behind this is quite fascinating. Chemotherapy drugs, as they break down, release a substance that triggers an area in the brain called the vomiting center. This center, as the name suggests, controls nausea and vomiting. Other side effects may include changes in taste and smell, mouth sores, increased risk of infections due to a weakened immune system, and changes in memory or thinking, often referred to as chemobrain. It's important to note that not everyone will experience all these side effects, and their severity can vary greatly. There are also many strategies and medications to manage these side effects and mitigate their impact. Remember, Chemotherapy is a potent ally in the fight against cancer, but like any other medication, it does have side effects. As with any medication, understanding these side effects is crucial for managing them and enhancing the patient's quality of life. Chemotherapy treatment isn't a one-size-fits-all. It's tailored to each patient's unique needs. To craft a treatment plan, doctors consider a multitude of factors. They're like detectives sifting through a patient's medical history, current health status, and the specific characteristics of their cancer. The type of cancer plays a pivotal role in shaping the treatment plan. You see, not all cancers react the same way to chemotherapy drugs. Some cancers may be more susceptible to certain drugs, while others may be resistant. For instance, breast cancer and lung cancer, despite being cancers, are treated with different chemotherapy drugs. It's like using different keys for different locks. Then there's the patient's overall health. Chemotherapy is a rigorous process that can take a toll on the body, so doctors need to ensure that the patient is physically capable of withstanding the treatment. They assess the patient's heart function, liver function, kidney function, and the body's overall ability to recover. If a patient has other health conditions like diabetes or heart disease, the treatment plan may need to be adjusted accordingly. Patient preferences also hold significant weight. Some patients may prefer a more aggressive treatment, while others may opt for a more conservative approach, depending on their personal circumstances and quality of life considerations. It's about finding a balance between the potential benefits and side effects of chemotherapy. The frequency and duration of the treatment is another key aspect. Chemotherapy is often given in cycles, with each cycle consisting of a treatment period followed by a rest period. The length of these cycles can vary depending on the type of cancer and the specific drugs used. In a nutshell, designing a chemotherapy treatment plan is a complex process that requires careful consideration of many different factors. It's a delicate balancing act between attacking the cancer aggressively and preserving the patient's health and quality of life. Remember, each patient's journey is unique, and so is their treatment plan. It's about personalizing the battle against cancer, making it a fight that each patient can withstand and hopefully win. With advancements in medical research, the future of chemotherapy looks promising. The realm of chemotherapy is not stagnant. It's a field that's evolving each day. The traditional chemotherapy we've known, which involves the use of drugs to destroy cancer cells, is giving way to more targeted and effective treatments. Let's delve into two of these promising advancements: targeted therapies and immunotherapies. Targeted therapies represent a shift from the traditional one-size-fits-all approach. Instead, these treatments are specifically designed to attack cancer cells by interfering with certain proteins or enzymes that help them grow and spread. This means that they can more effectively target cancer cells while leaving healthy cells relatively unharmed. On the other hand, we have immunotherapies. These are therapies that harness the power of our own immune system to fight cancer. They work by stimulating the immune system to recognize and attack cancer cells. This could potentially lead to more effective and longer-lasting responses to treatment. Both of these treatments have the potential to revolutionize the way we treat cancer. They might not only increase survival rates, but could also lead to fewer side effects and a better quality of life for patients. However, it's important to remember that these advancements are not without their challenges. For instance, not all types of cancer respond to targeted therapies or immunotherapies. Moreover, these treatments can sometimes cause severe immune-related side effects. Therefore, more research is needed to refine these therapies and to discover new ones. The future of chemotherapy is not just about new drugs or therapies, but also about finding more personalized approaches to treatment. This could involve tailoring treatment plans to the genetic makeup of a patient's tumor, or even developing therapies that can prevent cancer from occurring in the first place. While we've made great strides, the journey ahead is filled with endless possibilities and hope. We are in the midst of a paradigm shift in cancer treatment, and the future indeed looks promising. So, we've journeyed through the world of chemotherapy, but what are the key takeaways? Chemotherapy, a pillar in the fight against cancer, works by targeting and eliminating rapidly dividing cancer cells. Yet, it's not without its complexities. It's a treatment that requires a delicate balance, as the same qualities that allow it to attack cancer cells can also affect healthy cells, leading to side effects ranging from fatigue to hair loss. Treatment plans tailored to each patient's unique circumstances, are devised meticulously by medical professionals. They take into account factors such as the type of cancer, its stage, and the patient's overall health. Looking ahead, the future of chemotherapy is poised to become even more targeted and efficient. With advancements in medical technology, we are moving towards treatments that can minimize side effects while maximizing effectiveness. Remember, knowledge is power. The more we understand about treatments like chemotherapy, the more equipped we are to fight against diseases like cancer.